Tardive dyskinesia is a drug-induced movement disorder that can develop after prolonged exposure to certain classes of medication, including some mental health medications. People that have tardive dyskinesia may notice abnormal movements, most commonly in their face, but sometimes in their hands, feet, or other parts of their body as well. Medications that may cause tardive dyskinesia are often used for a variety of different reasons to treat anxiety, depression, mood stabilization, or even psychosis. When people develop tardive dyskinesia, this often presents as having more movement than what we would deem normal. This can be very bothersome to patients and may present looking like someone is uncomfortable or restless because of these movements. It's important that as a patient, if you develop abnormal movements and you're taking mental health medications, that you talk to your healthcare provider because treatments of tardive dyskinesia are available, and it's important to collaboratively discuss a game plan with your medical team. Tardive dyskinesia can present in many different ways. Most commonly, we may see abnormal movements in the facial region, and this may present as lip smacking, abnormal movements in the tongue, repetitive blinking, or facial grimacing. We can also see abnormal movements present in the upper extremities. And a common presentation of tardive dyskinesia can be piano playing fingers, where we experience slow, writhing movements in the hands or fingers. Keep in mind that tardive dyskinesia can present in any muscle of the body. So even though it's commonly presenting in the face or in the hands, it can also present in many different regions. And in those areas, it's important that we don't miss this and mistake it for something else. Because tardive dyskinesia can present in so many different ways, it's important that if you develop abnormal movements, you talk to your medical team so that together you can decide on a game plan and whether treatment is warranted. Screening for tardive dyskinesia can take many different forms. The American Psychiatric Association recommends that patients who may be on medications that carry a risk of tardive dyskinesia are screened at least once per year. That screening can be somewhat formal. Your provider may ask you to do a variety of physical maneuvers, such as moving your hands or sticking out your tongue to look for any subtle abnormal movements. Screening for tardive dyskinesia is critical. We often receive care in many different venues. Whether you're receiving care in a traditional in-office setting or in a virtual setting, it's important for us to understand how to help our providers conduct a successful TD screening. The provider may have you go through various maneuvers, such as holding your hands up or even walking. So it's important that in a virtual setting, you conduct the visit in a room that has enough opportunity for you to stand up and move around. If your provider is screening for TD in the office, they may ask you to take your shoes off. They may ask you to walk up and down the hallway. So it's important to collaborate and communicate with your provider if there's any parts of the TD screening that may be confusing, need more clarity, or may be difficult for you to conduct. For a virtual tardive dyskinesia screening, it's important that you set up your camera in a well-lit room. We may want to also have you put your camera somewhere where you can step back and the provider can see your entire body. It's really important, however, that both as patients and providers, we also are informally screening for tardive dyskinesia in between these annual assessments. At every appointment, your provider is probably at least doing a subtle assessment to look for the development of any new movements. And as a patient, it's very important that in between visits with your provider, you observe, and if you notice any abnormal movements developing, that you reach out to your provider. If a family or loved one expresses that they maybe are seeing something that you haven't, that's also a great opportunity to reach out to your medical team and pass along that information. It's important to have these collaborative discussions with your medical treatment team early on in the process to determine if the development of tardive dyskinesia requires treatment. In rural settings, there are unique barriers that may make tardive dyskinesia screening and treatment more difficult. In rural care, there may be less access to specialists. Very often, tardive dyskinesia is screened, treated, and managed by movement disorder neurologists or mental health practitioners. In rural settings, we may not have access to those providers, and primary care may be providing the majority of mental health care. Additionally, in rural settings, more care may be conducted virtually as patients may live farther away from their provider. While virtual settings do allow for a high-quality TD screening, many providers may not be as comfortable providing screening or treatment of tardive dyskinesia in a virtual care setting. Rural residents can play a very large role in increasing TD screenings. One of the most important things that we can do is if you see something, say something. Medicine is overwhelmed, and very often your provider may have 5 or 6 different things that they're trying to cover with you in a very short appointment. If you observe that you've developed abnormal movements, make sure to let your provider know. Sometimes we may not say anything because we don't think it's important, or maybe we think that our provider notices and is already monitoring. It's important that we initiate these conversations with our provider, which may then stimulate a deeper dive or a more formal evaluation. Similarly, if family or friends observe abnormal movements that have developed in a loved one or in someone else, it's important to pass that information on. Sometimes we may not observe in ourselves because it's subtle and it may develop over the course of several months. So keep in mind that it's never a bad thing to bring up questions, concerns, or new issues to your provider, because very often initiating that conversation is the first step in advocacy. Tardive dyskinesia is a condition that can develop, but it's treatable. The first step is making sure that we're engaging in these conversations and not just staying silent. I think sometimes patients feel that if they develop abnormal movements, that this isn't a treatable condition, or maybe it's something that is just part of mental health treatment. And that's no longer the case. We have options, but we can't discuss or review those options if those conversations don't happen.